Now we start scanning of right iliac region or right lower part of the abdomen. Here we see a small intestine having a continuous. These are gas shadows which are normally present in the small intestines. Here we see the small intestine is connecting with the cecum. Here we see a echogenic area which is the submucosal layer of the cecum which is severely inflamed. Here is also we see a hypoechoic area around the echogenic area. These are muscle layer of the cecum. Here we see a hypoechoic area or anechoic area which is look like a collection in the posterior muscle layer of the cecum. This is cyst-like appearance in the posterior wall of the cecum. Patient is feeling very pain. Even we are scanning with soft hand. And this area is also very tender. Now if we see the proximal part of ascending colon, the submucosal and muscle layers are also inflamed. Now if we see posterior to the collection or hypoechoic area, which also looks like a lumen-like structure. It may be a appendix, which is normal in size, approximately 2.6 millimeter. Now how we will write report. The submucosal layers and muscle layers of the cecum and proximal part of the ascending colon are inflamed. A cyst containing volume 10 milliliter also present in the posterior wall of the cecum. Peristalsis is absent in the cecum and proximal part of the ascending colon. Appendix is also present posterior to the cecum and it appears to be normal. Its anterior posterior diameter is 2.6 millimeter. No free fluid seen in the right iliac fossa and in the pelvic region. The ultrasound diagnosis is diverticulitis with spacious cyst and enterocolitis of cecum and ascending colon.